I'm Kenneth Schaufelberger. I'm an orthopedic surgeon at ThedaCare. I practice general orthopedics. I treat everything with the exception of spine. My specialty training is hand and upper extremity, but probably half of my practice is general orthopedics and the other half is shoulder, elbow, wrist, and hand. My philosophy of patient care is, even though our title is orthopedic surgeon, I try to avoid surgery as much as possible. So we can try physical therapy, shots, activity modifications, all those things before we would have any discussion about surgery. That's the way I would want to be treated if it was my condition. And if it comes to a time where we're talking about an intervention, I wouldn't recommend a procedure that I wouldn't have done on myself if I was in the same situation. Expectations are a huge predictor as far as outcomes. So I want everybody to be on the same page. I'm a big fan of anatomy drawings, models, going through what we're seeing as far as this is the reason and the structure that's causing the pain. Here's the things we can do to try to alleviate that with conservative care. And if it comes to the discussion of, hey, we need to do something about it because conservative care isn't working, here's how the surgery works, why it works, what you can expect as far as outcome, and how long it's going to take. The most rewarding part of my job is getting to see people get back to the level of function they had before their injury or before the onset of pain. Ideally, it's a forgotten joint where it's feeling so good and back to normal that they don't even think about it anymore and just get back to their lives. And hopefully I'll see them at the farmer's market or the local fair instead of my office. I'm excited to join ThedaCare because I think it's a great hospital system. If my family members or I ever needed care, that's where I would want them or myself to be treated. So I'm very excited to join the team.